1 in 10 graduating medical students last year wanted to pursue careers in general practice. The Royal Australian College of General Practitioners has been calling on the government to urgently boost incentives to improve the workforce. Joining me now is the RACGP President, Dr Nicole Higgins. Thanks for your time. Look, I don't know if 1 in 10 is low. I'm assuming it is. Is it coming down, and why? What does it need to be at, I guess, to sort of service the population?
Yeah, so I love being a GP, and when I did my training, about 45% of medical students became GPs. So now that number has been dropping with 15, 13%, and now we've got 10% of our medical students saying they want to be a specialist GP. And for a career that, it takes 11 years to become a specialist GP, it takes a long time. And we train with our other specialists, such as cardiologists and neurologists, but we do the first 8 years together and then we go off into the community to be GPs and further our training.
Yeah. So, I mean, and look, this is just anecdotal stuff, but if I'm in Canberra, I can get in to see a GP generally. Gee, it's hard to find a dermatologist and all these other specialists. Maybe it's a good thing more people are doing other services rather than GPs? Are there sort of shortages, not just, I know we hear about the GP shortages and that's what you would advocate for, but there are other shortages too, are there not?
There are indeed, and we need to make sure that medicine is accessible for all people, and especially in our rural and regional areas. I'm in
where the
regional
GP
town.
shortages are the
where the
hardest.
GP shortages are, access is really tricky. However, your GP is actually trained to do most of all of that stuff. So we've got a really wide depth and breadth of what we do, and that's what makes general practice fantastic. And we just need to get more training.
So why do not more people agree with you from these numbers? Is it earning money? Is it, I don't know, is there something more excited about saying I'm a surgeon, I'm this specialty, and a GP is a bit, all right, you see sick kids all day, do you? What is it?
Yeah, look, there is a bit of an image issue. It's not seen as sexy, but general practice has been devalued and defunded by successive governments over, the last 10 years. And as a medical graduate whom, big HECS debt, and our registrars or trainees are in their early 30s with families, to stay in a hospital system where you're paid often 2-3 times more than you would as a GP, plus all the entitlements like paid parental leave,
Don't run
leave.
a practice, get your holidays, all that sort of thing.
All that stuff.
And yet, if the pitch is, look, we need more ultimately funding in some way for GPs, is that going to be a hard sell? It's a tight budget, and what you're saying is give some more to doctors, and people might go, aren't doctors doing okay?
What we need to do is actually increase our workforce, because everyone deserves access to high quality general practice. And 22 million Australians see their GP every year and their family doctor. We need to make sure that we increase our workforce, so we need to grow our own, but also for those doctors who are wanting to come into the country to work, that we support them as well, because they largely hold up our rural and regional areas.
We're a big importer now, if that's not too crass a term. And what about spreading the load? I mean, I was reading today, pharmacies now have a permanent ability, for example, to assess and treat in terms of prescriptions UTIs. That'll free up doctors to a degree, especially emergency wards, in out of hours times. Is that the sort of thing that will work as well? So
we're currently looking at scope of practice, and that's the same for GP. So you said to see a dermatologist. If you've got acne and need Roaccutane, you have to go to a dermatologist versus seeing a GP. So scope goes across all of that. But we've got a
scope, or is it territory war, or a bit of both?
No, we've got a whole of workforce shortage. It's not just GPs. So we're going to be 11,000 short by 2032, but 100,000 nurses short. Shortage of pharmacists by 2,500, allied health. So we need to make sure that we increase our health workforce.
Okay, so that leads us to the budget.
Yes.
I'm not going to ask what you sort of would put on your wish list. Let's be realistic. What's a realistic thing you might see tonight that you're hoping for to address the sort of things you're talking about?
So look, 2 basic principles: affordable, accessible general practice care, so patients to close the gap, so not as much out of pocket, and also to increase workforce. So the commonest things we see in general practice are mental health and chronic disease. So we've asked for a 20% increase in funding of those consultations for patients so that they get more back when they see their GP. And also to ensure for our workforce that our young doctors in the community have parity with their hospital colleagues for parental leave, because they take a big pay drop when they come into the community.
Well, parental leave, a big one's being addressed elsewhere. The focus that they had on bulk billing is great for the people that get it, but doesn't really increase. It's a big spend and doesn't increase access. Is that a
Well, it actually, what it's done is slowed. It was exponentially dropping the bulk billing rate. It's slowed that, and it's increased it, especially our.
Is it a good use of limited
regional
money? I guess
it's been really targeted funding for those who need it the most. So our kids, our over 65s, and the bulk billing rate is still just under 80%. It's still reasonably high.
It sounds really high. I never speak to anyone that gets bulk billed. Maybe it's a Canberra thing.
Look, it depends where you are, and those who are paying the gap are actually cross-subsidising, and GPs have been subsidising our patients' rebate for a long time, and we've got to the point where cost of living crisis has hit us too. We can't afford to continue to subsidise that as well.
All right, Nicole Higgins, we'll let you go. Prepare for the budget.